Dr. Jere here with Mills Chiropractic and Wellness Center. And this week of Research That Matters, what I wanted to talk a little bit about was leg pain that's coming from the low back. Now, when nerves are irritated in the low back, it can compress a nerve or irritate a nerve, and that type of pain is called radicular pain. And there's several different reasons for it. It can come from the bone, it can come from disc, it can come from ligaments, it can simply come from inflammation. But what I want you to first of all to understand is that we successfully treat this all the time. So, sometimes people say, yeah, I have a bulging disc and, I'm going to have surgery. Well, not necessarily. In fact, the research is really saying that most of the time we can recover from these things without the needs for surgery or medication for years and years, which was kind of the old way of doing things, right? But as we learn more, we know more, we do better, right? And that's one of the things I wanted to talk about with radicular pain, or pain that shoots down the leg into the calf or into the foot. It can be pretty unpleasant and can be very excruciating type of pain if you've ever experienced that before. However, like I said, there's a lot of things that we can do about it, and we successfully treat this all the time. And so there's, like I said, several different types of radicular pain or causes for the radicular pain. It can be the bone that's growing and from osteoarthritis, which narrows the space around the nerve. One of the terms that sometimes you'll hear is IVF stenosis or nerve stenosis. And what that means is that the space around the nerve has gotten so small that it started to compress the nerve. And what actually happens in this situation is that the nerve, when it gets touched, the nerve will actually swell. So then what we end up with is a space that's been relatively small, usually for a very long period of time before we ever have the symptoms. But then once it touches that nerve gets bigger. Well, the space didn't get any bigger, and it didn't really even get any smaller. It's just that the nerve inside of that space got bigger, which then further compressed the nerve, right? Like small space, big nerve, still don't work. And so one of the things that happens is it creates inflammation and swelling, and then the nerve gets sticky, and then it can't glide, and then they go to move and it stretches the nerve, and the body really does not like stretch nerves at all. In fact, when we compress a nerve and we take the pressure off, the nerve will start to heal almost immediately. However, when we stretch a nerve, it can actually take days and weeks before the nerve even starts to heal. So nerves actually do a lot better when we compress them than when we stretch them. And a lot of times that's what's occurring. So that can be from bone growth, that can be from the disc. Sometimes the ligaments will actually enlarge over time because of injuries over time. We talked a little bit about how scar tissue can proliferate. That's kind of the same thing that kind of happens with the ligaments. They try to get bigger and stronger in order to support the spine. A lot of times when we have weak cores, we sit too much, we don't exercise enough, right? The body tries to figure out how can we provide more stability, and one of the ways that it does that is through this ligament hypertrophy or increasing the size of the ligaments, or perhaps, in the end stage, putting down more bone. So anyway, if you've had leg pain or foot pain, a lot of times, like I said, it's coming from the lower back, and that's something that we successfully see and we successfully treat. And one of the big things, like I talked about last week, is getting people moving, getting that nerve to glide through those areas again, getting inflammation reduced in the body, working on core strength. A lot of these things that don't necessarily involve drugs or surgery for these low back conditions. So if you know somebody that's suffered with sciatica or pain down the leg, or they're considering surgery, recommend chiropractic. Maybe we can help, maybe we can't. But most of the time, I really like our success rate, right? So anyway, I hope you get something from this video. I hope you get something from each of the videos. Stay healthy, stay well.